Hello, my name is Dr. Deepak Shetty. I work as a consultant gynecologist and IVF specialist in Indira IVF. Welcome. Today I'll be talking about IVF failures, the reasons for IVF failures, and what can we do to prevent it from happening again. So, for a patient, one of the most devastating things to face is to face a beta HCG negative report or abortion immediately after IVF. They would put their heart and mind into it, and they would have so high hopes about the results. But seeing a negative results can be very disappointing, depressing, as well as sometimes hopeless also. So they will ask us, Doctor, we did everything you asked us, but still we haven't got the results. So what are the reasons for IVF failures? And what can we do to prevent it from happening again? So we'll talk about this in this session. So one of the most important factors for IVF negative results is the embryo quality. Usually, it's always better to do something called blastocyst transfer. So what's a blastocyst transfer? So blastocyst transfer is when we culture the embryos till day 5 and use those embryos to transfer. So it's always better to transfer a day 5 embryo compared to day 3 embryo. If you have had a failure with day 3 embryo, then it would always be better to undergo a blastocyst transfer. Sometimes, even after blastocyst transfer, there can be a negative result. Patient will tell us, so you told us that it's a grade 1 embryo, but still IVF has been negative. So what is the reason for that? The reason for that is that because of some genetical factors. What grading we give is based on the physical nature of the embryo. So we don't know how is the chromosomal setup of that embryo. So there are ways to know the chromosomal abnormalities in that embryo. One of the way is by doing something called PGTA. It is pre-implantation genetic testing, where we subject this embryo for a genetic testing and we transfer only those embryos with normal chromosomes. This can improve the results, though it is not foolproof. So, moving on to next factor which can cause an IVF failure, it's endometrial factor. What is endometrium? Endometrium is actually a layer in uterus where the embryo implants. So the embryo takes its nutrition from the endometrium. So that's why the endometrial quality is very important for an IVF success. So what can happen in an endometrium that can cause negative IVF results? Sometimes there can be a polyp, which is just a mass of endometrium outgrowth. So that can be the reason. Or sometimes there can be endometrial TB or endometrial infection. This can cause negative results. So what do we do to tackle this? We can do something called hysteroscopy, where we put a camera inside the uterus and we see for any of these factors which can cause a negative IVF results. We can take a biopsy of the endometrium and subject it to test so that we can look for endometrial TB or any other infections. Another new technology available is called endometrial receptivity array, where we take the biopsy of the endometrium, we subject it to complex tests, and we can know which day is ideal for transfer of a particular embryo. This usually improves IVF success. So moving on from endometrial factors, we'll look at tubal factors. Tubes actually don't have a big role in IVF process, but sometimes there can be something called hydrosalpinx, where there is fluid in the tubes. This fluid can be toxic to the embryo, can move into the uterus, and it can prevent the embryo from growing further. This can cause a negative result or an abortion later. So, what do we do to prevent this? We can do something called salpingectomy, where we remove these tubes, or we can do something called laparoscopic clipping, where we can prevent this fluid from entering the uterine cavity and thereby preventing the fluid from causing an abortion or a negative IVF result. So moving on from tubal factor, we'll move on to immunological factor. What is immunological factors? So sometimes what happens is mother's own immunological system can act against the embryo, and it can prevent implantation from happening, or it can cause an abortion. So moving on, there is one more important factor that can cause a negative IVF result or abortion. That is immunological factor. So what is immunological factor? Sometimes mother's own immunity can act against the embryo, and it can prevent it from implanting, or it can cause an abortion. So what do we do to tackle this? There are many ways. One of the ways is to give something called immunomodulators. What are immunomodulators? It will decrease the maternal's immune system to act against the embryo. So what do we give? We give steroids. We give something called intralipid solution for this purpose. And usually such complications will be decreased by giving these medicines. One more new therapy is called LIT, lymphocyte immunological therapy, where we take male partner's blood and we inject it into the female partner's skin. So this can prime the maternal immunological system so that it does not act against the baby or the embryo for that matter. So these are all specific factors why IVF failure can happen, and these are the solutions which are available. So there are a lot of other general things also, some medical conditions like hypothyroidism, hyperthyroidism, or diabetes mellitus, high BP. All these can affect IVF results. So before going into an IVF process, it will be better to improve all these conditions so that IVF failures are less. A lot of lifestyle modifications like preventing junk food, or having a healthy diet, or exercising regularly, or decreasing obesity can improve IVF results a lot. So in conclusion, what I want to tell is that having an IVF failure is not the end of the world. And there are many other ways to mitigate these issues and to give successful pregnancy. So my advice to my patients would be not lose hope if you have an IVF failure, because we have had a lot of patients who have had successful pregnancy even after IVF failures. So if you have any other doubts regarding IVF failures or any other doubts regarding infertility, you can contact us, or you can reach out to us to our closest Indira IVF center. We are India's largest IVF chain. We have more than 100 centers. Thank you.